Hello, Cliff. How are you?
I'm doing well. Besides the little glitches in hearing you on the phone, I'm hanging in there, Sam.
Oh, can you hear me well or no?
No, I'm being a jerk and making glitch jokes. See, right
Oh,
off. I
there you
gotta go
go.
and start
You're
off
already
that way
starting.
with unfunny jokes. It's
You're
amazing.
you are caught up in the healthcare.gov hysteria.
It is. It's freaking glitch fever, baby, and I'm mad.
Are you really
I'm
mad?
I'm thinking of maybe sitting too close to the TV set, maybe going to sleep without brushing my teeth. The stuff that angry Jews do.
I understand. I understand. Wow, we can
Uh,
hear it. We can feel it from here. Um,
No, this glitch stuff is no. I'm not mad actually. I mean, it's. I guess we might as well just get right into it. It's disappointing and rather shocking that the Obama folks handled this as badly as they did. But I guess when it comes to sort of marketing, this isn't really marketing, but sort of some of these types of aspects of their policy, they've been shockingly inept in the past, and so I'm not hugely surprised by that. But that doesn't change the fact that this is health care for people who need it, who have pre-existing conditions, and kids without health care, and people who've lost their jobs without health care, and people that have diseases that will make them blow up any lifetime limit, which there now won't be, on what they can spend and the rest. And so, as usual, I know there's a big war out there between people saying, "Oh, you can't criticize it," or "Oh, you must criticize it." And as usual, these two sides, there's always sort of a third. Oh, I don't want to use the term third way, but oh my God, but no, but there's always there's perspective here. Which is that you can criticize it and say, why did you guys not do a better job on this? And at the same time, let's keep in perspective that this is ridiculous, that people, that most of the people, that not most, everyone on the right who's flipping out about this are the people that just shut down the government over trying to defund these things, who are lunatics. And let me see. I'm going to do a quick, I promise you in about 15 seconds, every 2 years of the Bush administration. Ready? Allowed 9/11 to happen, started the Iraq War, thought it was cool to allow Katrina to hit us, financial collapse. That's basically your every 2 years in the Bush administration. But glitches should definitely be investigated.
I mean,
We should we should
I think from my perspective, there's a couple of different stories that are interesting, and I think obviously, look, a big part of this, I'm somewhat convinced, is just there's a bit of a news vacuum, and I mean, this is not to downplay the implications of this, and it's also
It's all it's balanced too, Sam.
well, I
They
mean,
spent a month and a half beating up on people that are crazy and almost brought down the world economy. Let's find something. Where is there a way that Democrats are equivalent? Oh yeah, there's glitches. So let's talk about that. I mean, there's so much of that is coming from the usual quarters, the usual morning Starbucks and places like that feel a need because they feel guilty. They have guilty consciences because they beat up on Republicans and right-wing lunatics for the last 6 weeks. So they've got to do something to hit the left.
I mean, I think that's part of it. I think and I think even the sort of more technocratic press, I guess, that is all over this, and as well they should be. But it seems to me that the big story here, there's a couple of stories that are sort of being, a couple of angles, I should say, that are not getting enough attention. And just running them down is one, there's obviously a huge procurement problem with the government. Two, there's also, look, this was not the level of complication built into this system, which was necessary if you're going to pursue what amounts to a neoliberal version of providing something that could far more easily be provided, but if the government didn't have to, rather than enable the private industry that was sort of collapsing, the health insurance industry, rather than having to enable them, if they had just bypassed them. And there's a couple of good pieces on this, and on some level, I think I saw some post that said that Bernie Sanders had sort of, if not predicted the specifics of this, but predicted that this would be an issue in terms of why making this more complicated, and it was essentially to to make it more complicated, essentially to placate, those people who feel like the free market is or the private sector is the best way to do this. Now, we should say,
isn't it great? It just adds to everything else, which is all the other ways that the original healthcare intent was sort of the intent of what we wanted was bastardized to make people happy that would never support the thing anyhow.
Right, exactly. I mean, that is the sort of the classic dynamic that exists here, and there's, you can find pieces out there. I guess the just to go over what is specifically wrong, or what is the challenge here with this component of the Affordable Care Act, is that you need a website, and really it's not just a website. What we're talking about is a data management system where people enter the front end. Because you have 36 states that didn't set up their own exchanges. You need to be able to take information from these from people in 36 different states. You need to first determine their income eligibility, which means that this information has to ping out to about 4 or 5 different agencies and then come back in. Then when you find out eligibility, you need to find out what possible private plans they're eligible for. In that instance, you need to then ping out information to the back ends of private insurance companies' sites, get that information and bring it back. And I don't know if you watched the hearings at all yesterday. I did, at least some of it, and
wow, you've got a pretty interesting life.
No kidding. And
just messing with you. Good.
No, well, I mean, I think you're on to something there, but it was sort of a joke, because we know that the Republicans are just using this not to get to the bottom of this, although they would love to find some type of scandal, which I think really the scandal is just that, we have procurement process that is completely larded up. And it just made it that much more difficult to genuinely get to the bottom of it. But before people start to say, hey, this is something that should have been farmed out totally, particularly the sort of the oversight of the entire project to the private industry, there's about a half a dozen examples of this happening during the 90s and during the early 2000s, particularly with the Defense Department, which show that a private firm couldn't have done this any better. And
right. I mean, that's exactly right. I think we're on the same page here, Sam. Let me read you the beginning, just the first paragraph, very short here, of this piece. In 2011, when Barack Obama had only been president for 2.5 years, there was some other guy with some other name who was a Republican president for most of the decade. Here you go.
Hey, remember me?
Quote, as much as $60 billion in U.S. funds has been lost to waste and fraud in Iraq and Afghanistan over the past decade through lax oversight of contractors, poor planning, and payoffs to warlords and insurgents. An independent panel investigating U.S. wartime spending estimates. There you go. This is the argument that needs to be had, the broader argument, which drives me crazy about a lot of the stuff that the left has spent the last 30 years retreating on, which is, you know what? Let's get some people to listen to this. Government's more efficient. Government does it better than big business. They do. Medicare, 2 to 3% overhead,
right,
is what you're talking about. Yet we have to pass a law as part of Obamacare just to allow these guys to have 20%. Make sure there's an 80-20 ratio. And they're complaining about that. Had there been a public option, my God, if they'd had to actually compete with a government entity and live up to that, they would have never been able to do it, which is why a lot of them are probably scared of going out of business. We took something here, and by using the private market, we made it more complicated, and we put it in the hands of people that were much more likely to waste money and not care. And guess what happened? These things happened as we expect them. Just say the words Blackwater, Halliburton, and anything else you want to say to yourself. And when we start privatizing vast swaths of our government, handing it over to contractors, and not doing it within our government, and having people who are there, not who are bureaucrats. Yeah, there are some people like that, but mostly people who are there who are accepting less money than they can make in the private sector because they care. And they want to be doing things the right way. That's one big part of this, which is the argument that needs to be made that President Obama, frankly, sadly, hasn't made enough and should be made more by Democrats of all stripes, which is government does work. Government does help people. Why don't we list the million ways it's done that in the last century? And it's more efficient. So this myth that big corporations that don't know their ass from a hole in the ground are more efficient. I don't know. Ask J.P. Morgan how efficient they are. I love their kind of efficiency. And then the other thing I would say is, to every Rand Paul type person that throws out of their mouth and still does it without a look to history, states' rights, just tell them to shut up. Because not only are we talking about the kind of racism, segregation, slavery, and everything else that went on because of their states' rights, but also, as this proves, states do not do it better. When you allow states to have their say, 30 of these states who just reject Medicaid and won't do anything to expand health care and won't run exchanges, and it gets put on all sorts of things get put on the federal government that they didn't expect to have to do. So let's have them expect to have to do it, because you can't trust states.
Right.
There's some things that need to be standard across the entire country. Healthcare should be one of those things.
Now, Mike Consul has a great piece out about the implications for liberalism in the ACA rollout, and he walks through essentially the four problems that the system is having. And he says the first has to do with the means testing of the program, because, and like I mentioned up top, the Government Accountability Office talks about this data hub, okay, which would determine means testing, essentially your eligibility for an incentive, a subsidy, which will ultimately go to these private insurance companies, and the data hub determines that. The data hub has to verify an applicant's Social Security number with the Social Security Administration, has to access data from the Internal Revenue Service, has to access data from the Department of Homeland Security to assess applicants' income, citizenship, and immigration status, those three entities. The Data Hub is also expected to access information from the Veterans Health Administration to see if you've got health care through them, the Department of Defense, the Office of Personnel Management, and the Peace Corps to enable the exchanges to determine if an applicant is eligible for insurance coverage. Okay, so these are all necessary to do this type of essentially means testing, which is relevant because we know how much means testing is pushed for other programs. The second issue it deals with, once you've means tested, then you've got to go to the back ends of all these insurance companies. The third issue is that with the sort of the failure of what's happening here is that this could create, because, and this is an interesting theory and it's not quite clear if this has been borne out, and we're going to need more time to find out, but the people who want health insurance the most, we assume, are going to be the people who are the sickest or the most likely to be sick or have pre-existing conditions. Therefore, they're the ones who are going to continue to go back to these exchanges over and over again until they get the health insurance. That's going to create adverse selection. In other words, you're going to have risk pools that are filled with people who are a little more sick. And the fourth issue with this, of course, has to do with the fact that they've had to pick up so much, the federal government has had to pick up so much slack from the states that have opted not to have their own exchanges. We know there's some great success stories in states that have their own exchanges. And then he basically breaks it down. He says, is this a problem with liberalism, or is this a problem with what we normally call neo-liberalism, or sort of market-based solutions, or solutions that are sort of market-based in conjunction with the government? Right. And he breaks it down into two.
Public-private partnerships.
Exactly. And he breaks it down into two categories. Category A is this one we're talking about, this public-private thing. And he says, one, it's heavily means-tested. Two, and remember, this applies for Paul Ryan's Medicare plan. This applies to the idea of means testing Social Security. This applies to anything that you hear with the names reinventing government or that type of stuff. And so number one is heavily means tested. Two, it's provided by private agents to individuals. In other words, outsourced to private agencies, leaves open the possibility of adverse selection, gives discretion to the states to either help or undermine the process, is designed to ensure choice and competition. And then he says category B, which we would perceive as being sort of old style big government programs. One, it's a program that is universal to all who qualify for it. In other words, all Americans. Right. Two, has the government running the insurance system itself. Uses compulsion to default people into social insurance to prevent adverse selection, i.e., Social Security and Medicare. Situates the program at a federal level to avoid states undermining it. Does all this to ensure provisioning outcomes using government scale and efficiency. In other words, Medicare, the 3% cost that you talk about. And one category is the market-based solutions pushed by the Heritage Foundation, adopted in this case by our body politic to deal with covering people for insurance. And the other is the way that we used to look at these things when we talk about things like Social Security and Medicaid, Medicare. And people should remember the one part of this that has been an unmitigated success is the adoption of Medicaid by states that choose to adopt it. In those instances, we are seeing hundreds of thousands of new people, millions of people, getting health insurance in a way that has not been problematic.
That's right.
And we, frankly, the conversation needs to be broadened. I think we talked about, at least earlier this week, Ezra Klein and Sarah Palin both made the point that this is just making the argument that a single payer would be far more efficient. And right. We need to hear people make that argument more.
That's exactly right. That's the conclusion that these guys, when they attack all this kind of stuff, won't come to, that it's just simple for our side. It's just the way convincing people of the program, if we had just done Medicare for all, would have been safe, easy, simple. When you go to through all these sort of hoops, and you provide tax, which is essentially neoliberal economics, tax incentives here, and you give people their additional government funding there, and in the end, all you end up doing is creating a sort of big patchwork system that lacks sort of an easy way to explain it, an easy way to understand it. There's so many moving parts, and inevitably, not only is it tougher for people to understand who are receiving it, but also those who are administering it. And, a standard program from the federal government that affects everybody the same way, that's, in the end, of course, that's what Medicaid should be too. I don't know the legal issues with it. If I'm correct in remembering, that was one of the things about the ACA that the Supreme Court said, is that the Medicaid part of it couldn't be forced on states.
That's right.
I think the problem here is that Medicaid shouldn't have to be forced on states. It should just be completely administered by the federal government, so they don't have a say, because they're not involved in the process. Because why is it that you should be treated differently if you live in Alabama than if you live in New York? How is that fair? And frankly, how does that fit under constitutional protections of equality, for that matter?
Just to remind people, the issue for the Supreme Court in that case was that because the federal government was planning to expand Medicaid, they would have expanded it to cover people who lived up to 133% in poverty. The expansion basically came with, you've got to accept this expansion or you're going to lose Medicaid. In other words, we're going to change Medicaid. This is what it's going to be. 3 or 4 years down the road, for 3 or 4 years, you won't have to pay anything to the states. 3 or 4 years down the road, maybe you'll have to pick up 10% of the cost, maybe. And the Supreme Court, in some type of bizarre ruling, I remember going down to the Supreme Court when they were hearing the arguments on this, and this was the one thing that I kept bringing up with all those people. And I encourage people, if they're interested, go back and look for that show. I was down in D.C. and I kept asking legal analyst after legal analyst, like, what's this part? Like, how is this possible? And almost to a person, they all said it would be bizarre for the Supreme Court to rule that way, because it would basically be saying like that it's you can't get it would be pulling back on the highway funds. You can't get highway funds if you don't lower your your speed limits to 55, or you raise your drinking age to 21, whatever it was. I mean, they said it was basically unprecedented. It's probably not going to be something that is in there, and I kept saying, well, why did they choose to hear this part? And the Supreme Court came out with this bizarre ruling, because had they shut down Medicaid and then said, okay, states, here's your new Medicaid option, it's going to include this increase, states wouldn't have had a right to complain about it under this ruling. It was just bizarre. But people should also know that the implications of this, I think, are going to be a lot less when we're talking about this 6 or 7 months from now, because you can always extend open enrollment. You can also delay the mandate in specific states where people are having trouble with this, because they're not having a trouble with it in New York. They're not having a trouble with it in California and about a dozen other states. So there's a lot of different fixes, but most people don't get their health insurance until the last minute anyways, because that's just sort of been the trend, at least in Massachusetts. So I think a lot of this has to do with just filling time on cable television, but
isn't so much of what we do these days is exactly about that.
I think so. I mean, I
think it's the usual sort of wide variety of things at work here. It's they need to fill time, and there's a void. It's the fake balance, of the sort of centrist media. It's the right-wing media being sort of viciously angry, which is a general sort of personality trait for them, but even more so over the last 6 weeks, because they've been proven again and again what fools they were. All these people who said, shut down the government, that's a good idea. It's going to totally poll differently this time than it did in the mid-'90s. They've collapsed to the point where people like Charlie Cook are saying that they could lose the House, not just those of us who lean left. But and so they need something to try to change the dynamic, and look at what's coming up, Sam, and don't think that that's not a part of this too, with people on the right knowing what's coming up, which is we've got President Obama talking about immigration now.
Yep.
You're gonna have the same split with the Chamber of Commerce and the business type Republicans saying you have to do this. And you're going to have the same lunatic fringe of the Steve Kings and the Cantaloupe Calves and Michelle Bachmann, Louis Gohmert, and those cast of cartoon characters are going to be screaming and yelling about terror babies and end times and things of that sort, and which is going to just damage them that much more. And then in January we go back to whether the people who want to shut down the government again. There's going to be a whole bunch of them that are going to want to do that. And are going to try to do the same thing again. They may not have the numbers this time, but and it may not happen, but they'll still be interviewed by outlets, and they'll still be written about, and people will still see them on TV. And then suddenly there'll be the debt deniers, right? The debt truthers, who in February will want to let that whole thing go crazy again. So it's not like there's a lot of really good months for the Republican Party up ahead. If they could sort of figure out a way to eliminate our ability to record things with video. I think they'd be in great shape. But barring that invention, so they've got to take these shots now.
Yeah.
Because, there's a pretty clear, at this point, political wind blowing in their faces.